Thank you, Speaker. I rise on behalf of the Greens to add our contribution to the Health Legislation Miscellaneous Amendments Bill 2022 and can say up front that the Greens do support this legislation, but I wanted to put on the record a number of specific concerns we have about elements of this miscellaneous bill, and I feel certain that our Greens health spokesperson Kate Fairman in the other place will go into more detail on some of these concerns and would hope that the Minister will respond to these in his reply. If I may, the bill updates a number of pieces of health legislation as well as extending the COVID provisions to 30th of June 2022 that would have otherwise been repealed on the 26th of March and the 31st of March. There are three main sections to the bill as well as a number of other additional sort of smaller amendments. The first one being around amendments to the Health Practitioner Regulation Adoption of National Law Act 2009. The second being around extending the COVID-19 provisions through a number of different acts, including the Private Health Facilities Act, the Public Health Act and the Mental Health Act, and the third being in relation to amendments following the statutory review into the Public Health Act, and particularly sections 62 and 79. Before I go into the detail of this bill, I wanted to acknowledge the fact that there are a number of amazing social work students from the University of Western Sydney who are sadly unable to join us in the gallery, Speaker, just in front of you here. I would have liked to have bring them in, but I think the logistics of getting 35 people to do rat tests might have sent everyone at the Department of Parliamentary Services off the edge today. So I want to acknowledge that they are standing in the foyer and watching, and I think it's really powerful to know that they are currently studying at the University of Western Sydney. They are social work students and they're connected with a program through the Sydney Alliance, which is looking to create community organisers and to activate people working in a whole range of different areas and studying in a whole different areas. I was just talking to them, and as social work students, they feel as passionately about this health legislation and other health legislation as they do about affordable housing, about mental health care support and about climate action. And I just want to acknowledge that it would be lovely if they could be in here. And I thank Genevieve Kelly, a local constituent in Newtown, for bringing them in to watch, sadly, just on the TV screen outside. If I can turn to the details of the bill, the amendments around the Health Practitioner Regulation Adoption of National Law Act 2009, the Greens support, and we recognise the reasoning for this as been outlined by the Minister and other speakers in relation to this bill. In relation to the COVID protection provisions and the extension of those under the Private Health Facilities Act, the Public Health Act and the Mental Health Act, we recognise that these are also going to be supported by the Greens to extend these provisions to the 30th of June. That said, we wanted to specifically raise a couple of concerns in relation to this. The first was in relation to the fact that it will allow and expand the ability for police to hand out on-the-spot fines. We recognise that there were very, very difficult and pressing times where the police stepped in to engage with ensuring that public health orders were followed. But we also know that the impact of who was given a fine, who was issued a fine in communities, were often people that were at most risk or most vulnerable, or were finding themselves in situations where for their own lack of financial security or support were unable to be able to comply with health orders. And we want to make sure that we're just flagging that we do not think that police should be used as an ongoing measure to be able to fine people in relation to public health orders. We recognise there was a specific period of time, but we also recognise that there is a need to look at the unintended consequences about the economic inequality that exists in this state and about other measures of inequality where fines will disproportionately impact certain people in highly stressful ways and in highly intense ways. A fine for someone on the wage of a parliamentarian is going to be very different for a fine on someone living on disability support benefits. And I think we need to recognise the inequality that is inherent in a system that sees fines in this way, used in this way. That said, I recognise that there has been a reason for those, and we won't be opposing the expansion of that until June 2022. The other area that I wish to flag, and that my Greens colleague in the other place, Kate Fairman, will go into more detail around, is around the issues of mental health and the fact that there is a need to recognise that while there was absolutely an essential requirement for mental health support to be provided to people through telehealth during the COVID period and during lockdown, we would hate to see a scenario, and we're going to consult more with some of the key organisations and groups that are advocates within the mental health space to make sure that we don't see a slippage where telehealth for mental health provisions rather than face-to-face is seen as a more efficient or cost-effective measure to be able to continue to roll out, and recognise that there was a reason for that, and for some people engaging in telehealth may be a good and useful way to continue on, but we would hate to see pressures put on community health and other providers to move into a system where it was seen as more efficient or a cost-saving measure to move into that space. And I think we just need to be aware as we come out of COVID what we're keeping and what we're transitioning, and making sure that we take the good bits and flexibility, but we don't cause harm in that process or unintended consequences. The final part in relation to this health legislation miscellaneous amendment bill that I wanted to turn to was specifically in relation to the statutory review into the Public Health Act 2010. Now, that statutory review, I want to specifically acknowledge the work of ACON, who made a submission to that review process in December 2020, and recognise that they actually expressed the need for there to be no changes to Section 79 of the Public Health Act, and also recommended a review of the penalties outlined in Section 79 of the Public Health Act. ACON also recommended that there be no changes to Section 62 of the Public Health Act. In both of those cases, we are seeing changes, and I wanted to flag the fact that ACON has expressed concern, as they do and have consistently for decades and decades, that when it comes to infectious disease control, including STIs and HIV transmission, it is a health and not a criminal issue. And specifically, I want to put on the record ACON's concerns around Section 79, where they state, overall, ACON does not support amendments that legislate reasonable precautions, as such legislation will be unlikely to reflect changing standards on what reasonable precautions are in a timely way. Now, we know that in all instances, and I could say all instances, this place and the Parliament takes longer to catch up than where everything else is out there in the world. Things move much more quickly out there in the world than they do in the Parliament when it comes to changing laws. And I think that we would say in the areas of medical science, in the areas of medical research and health research, it is clear that the kinds of preventative technologies that we've seen when we look at PrEP, when we look at the confirmation of the impact of undetectable viral loads, and on those, the horizon for potential, gonorrhea vaccinations and other kind of advances in science and medical research, the idea that we would be legislating now for what are reasonable precautions when we know things are moving so quickly has cause for concern with ACON, and they are recommending that no changes to Section 79 of the Public Health Act occur. I want to also highlight that they recommend similar in relation to Section 62 of the Public Health Act, and want to highlight the fact that there are concerns that in both of these cases that there is not a need to do that, because ACON believes that Section 62, along with other provisions of the Act, strike the right balance between the rights of the individuals and the need to protect public health. I appreciate that the Minister has a long and ongoing dialogue with ACON, and I welcome the fact that there has been such constructive conversations that have occurred in this space in the past. I do wish to put on the record, though, that ACON and their submission and contributions in relation to that public health statutory review in relation to Section 62 and 79. And I'd just like to end by saying that I think that it is really important, as many members who have contributed to this debate do, that in making these contributions we recognise that the people at the front lines of providing healthcare during the COVID times, providing mental health care support during the COVID times, and recognising all of the above and beyond work that they have done to keep our community safe has been incredible. I want to acknowledge and thank them for their work, but I also want to recognise that, as with the teachers, the nurses, the doctors, the people working in our frontline healthcare system, thanks is not enough, and we need to show them our gratitude by making sure that they are given the pay, conditions and remuneration that they need to make sure that they can keep doing the vital work that they are doing to keep our communities healthy and safe.